Hi everyone, my name is Dr. Tochukwu Okwuosa. I'm a cardiologist at Rush University Medical Center, and I'm a professor of cardiology and the director of Cardio-Oncology at Rush.
Hi, and I'm Rohan Khera. I'm a cardiologist and data scientist at the Yale School of Medicine, where I lead the cardiovascular data science lab.
Some of the things that we want to point out about the statement are like the initial part of it, we particularly focused on risk assessment, right? So we think about the cardiovascular risk markers that we can use in identifying patients at risk and how we can tailor those leveraging artificial intelligence in helping us assess those risks in future. So we talked about imaging biomarkers, whether we're talking about echo, of course, is a pretty common one, with strain echo playing a role to a certain extent, cardiac MRI, cardiac CT scans, EKGs even, nuclear imaging of some sort, like PET imaging and so on, how these imaging biomarkers could play a role. And then we also have a different section that focuses on the typical lab data, lab biomarkers, right? So we think about troponins, BNPs, and other biomarkers that people have been kind of assessing in the cardio-oncology population that may play a role in future, present or in future. And I want to, in our scientific statement, tables 1 and table 2, particularly focus on these biomarkers, thinking about how we're using them now and how we can possibly leverage them in future for using artificial intelligence for better precision medicine in managing this patient population. And then Dr. Khera, table 3 particularly focuses on the glossary of terms and the sort of,
I think the
to help people understand better.
I think the idea is like, many people who will read these statements will be coming at these domains for the first time, engaging them because there'll be clinicians who have not encountered them as effectively. So table 3 focuses on that and actually cross-references many of the themes that are present throughout the statement, as well as through tables 1 and 2. And I think that, as you said, tables 1 and 2 have is the meat of the article, because
Absolutely.
it really focuses on the idea that they have they have existing biomarkers and how we use them, whether they can be enhanced with artificial intelligence further,
Right.
and are there newer data streams that we always like electrocardiograms. We could view them, we could interpret clinical abnormalities, but now there are emerging AI applications that identify who would have cardiotoxic effects from any of the cardiotoxic chemotherapy agents. So I think there is so many discussion points there that are highlighted in those tables.